Hematopoietic stem cells can also differentiate into cells that produce platelets. So there's a hormone called thrombopoietin that stimulates myeloid stem cells to develop into these great big cells called megakaryocytes. These huge megakaryocytes then splinter into 2,000 to 3,000 fragments. Each fragment is a platelet. So the platelets break off from the megakaryocytes in the red bone marrow, and then they enter the blood circulation, where they survive for about 5 to 9 or 10 days. So between 150 to 400,000 platelets are present in each microliter of blood. Each platelet is very irregular shaped because it's just a fragment. Somewhere around 2 to 4 micrometers in diameter, so very, very small. It has many vesicles, but no nucleus, because remember, these are just cell fragments. So the granules that are contained in the vesicles have chemicals that when they're released, they promote blood clotting, because that's the job of platelets, is to stop blood loss from damaged vessels. And it does so by forming a temporary little platelet plug. So even though they have a very short lifespan, they have a very important function. Hemostasis is the stopping of blood loss. So don't confuse this with homeostasis. Remember, homeostasis is maintaining balance. Hemostasis is a sequence of events that stops bleeding. So when blood vessels are damaged or ruptured, the response has to be very quick. It needs to be localized to just that area of the damage, but it also needs to be very carefully controlled if it's going to be effective. So hemostasis prevents hemorrhage, or a loss of a large amount of blood from those vesicles, or from those damaged vessels. So there are 3 steps involved in hemostasis. The first is vascular spasm, the second is forming a platelet plug, and the third is blood clotting, which is known as coagulation. So the first step, vascular spasm, happens when arteries or arterioles are damaged. So the smooth muscle in the blood vessel wall constricts or contracts very quickly, and that's a reaction called a vascular spasm. Just like when you have a muscle spasm in your arm or in your face or whatever. It's a very quick contraction of that muscle. So that vascular spasm, of course, is going to reduce the size of the lumen of that blood vessel by that muscle contracting, and that reduces the blood loss for a few minutes or even up to a few hours. This also gives the other parts of the hemostasis reaction time to get started and to get into operation. The spasm is thought to be caused by damage to the smooth muscle that lines the vessel, but also the release of serotonin from activated platelets in damaged tissues, and just simply reflexive action by pain receptors. So those platelets stick to the collagen fibers of those broken blood vessels. So once the vessel is broken, you've got sticky, rigid collagen fibers sticking into what was once a nice smooth blood vessel. The platelets then start attaching or hanging on that. So you can think of it very much like you rub a cotton ball across a piece of Velcro. So it starts sticking. Here you can see an image of that. So you've got your normal undamaged blood vessel in the image at the top, and the platelets and the blood and everything is flowing through nice and smooth because you've got that undamaged endothelium. But then something happens, and once that tissue is damaged, collagen fibers are exposed, and the platelets that were just flowing along now start to aggregate. They stick onto that damaged tissue, to that exposed collagen. Platelets are sticky. Once platelets start to pile up, even more platelets start to pile up, which causes a bigger platelet plug, which means more and more platelets pile up, which makes a bigger plug, which means even more platelets stick to it and pile up. So that's a positive feedback reaction that we call platelet aggregation that provides that temporary stop in blood loss. And this is usually very effective in damage to small blood vessels. Okay, so we've seen the first 2 steps, which are pretty easy to understand. Number 1, vascular spasm occurs. Number 2, platelets aggregate when the platelets start sticking to those exposed collagen fibers within the blood vessel. So that's pretty easy. That happens pretty quickly, but that's not enough because the platelet plug's not going to stay there. Vascular spasm is not going to remain in place, right? So a spasm only lasts for so long. In order to really stop that blood from leaking out of that vessel, we've got to form a clot. So clotting is what is known as coagulation. This is a pretty complicated pathway that I'm going to try to simplify for you. But there are several factors that have to play a role in coagulation. Some of those factors include calcium ions, some inactive enzymes that are made by liver cells and then released into the blood, and other molecules that are associated with the platelets or released by the damaged tissues. So there's a lot of clotting factors that are named with Roman numerals, but the important one that we're going to look at is clotting factor number 10. So clotting is a complex cascade of enzymatic reactions where one clotting factor activates the next clotting factor in the pathway. So it's a fixed sequence. And then finally, once all the clotting factors have been activated, it results in a really tough, insoluble, net-like protein called fibrin, and fibrin is what forms the clot. So if you look at this image, you can see there is an extrinsic pathway and an intrinsic pathway. The extrinsic pathway of clotting happens within a few seconds. So tissue factor, we just call it TF, you'll see it at the top here, tissue factor TF, in the presence of calcium, is going to activate clotting factor 10. Okay? So tissue factor leaks into the blood from outside the blood vessels. That's what extrinsic means, outside of. So in the presence of calcium, tissue factor begins a sequence of reactions that ultimately activates clotting factor 10. Okay? Once clotting factor 10 is activated in the presence of calcium, it's going to combine with the intrinsic pathway. So the intrinsic pathway of blood clotting is much more complex and it occurs more slowly. But both of these reactions have to happen simultaneously in order for a clot to form. So the intrinsic pathway is named because its activators are either in the blood or in direct contact with the blood. So intrinsic means within. So you've got these clotting factors that are in the blood that are activated because of the damaged platelets releasing chemicals. Now, this is where it gets a little complicated, so we're going to summarize this. These damaged tissues activate the intrinsic pathway, which begins an enzyme pathway that activates clotting factors in the presence of calcium, that activate other clotting factors in the presence of calcium. Okay? So remember, there are a lot of clotting factors in this pathway. We're leaving out a lot of the early steps so we can get down here to activating clotting factor 10. Remember, X is 10 in Roman numerals. So once clotting factor 10 is activated, that's where we get into the good stuff. Okay? So this is where the two pathways merge together. Clotting factor 10 forms an enzyme or activates an enzyme called prothrombinase. ACE, remember, enzyme. Prothrombinase takes prothrombin in the presence of calcium and activates it into thrombin. Okay, so all these clotting factors are inactive until there's tissue damage, right? We don't want blood clots happening when there's not damage, right? Okay, so all these enzymatic pathways and all these activations of clotting factors lead to this enzyme being made. Prothrombinase activates prothrombin into active thrombin. Thrombin, in the presence of calcium, takes fibrinogen and activates it into fibrin. Fibrin forms the clot. As you can see over here in this image, all these little brown stringy things, all of that is fibrin. So it's forming a blood clot. So when you see pro, like prothrombin, that's usually the beginning of something. When you see gen, that's the beginning of something. So a lot of times in the human body, prothrombin, pro-insulin, pro-whatever is inactive, and it has to be changed enzymatically to become active. Same thing with fibrinogen. It is in the blood in the inactive form, and only when these two pathways begin that domino effect do we have prothrombin change to thrombin, and then thrombin cleaves fibrinogen to active fibrin, and that forms the clot. All right, so here's sort of the gist of all of that. Clotting factor 10 is activated by the intrinsic and extrinsic pathway. Factor 10 then activates prothrombin activator. Prothrombin activator, that's your prothrombinase, converts thrombin to prothrombin. Prothrombin is now thrombin. Thrombin converts fibrinogen to fibrin. Fibrin forms the clot. Now the important thing to remember, this is all enzymatically driven, and it only happens in the presence of calcium. So calcium is a cofactor in these reactions. Once a clot is formed, it plugs that damaged area of the blood vessel and bleeding stops. So then clot retraction begins. So clot retraction is consolidating or tightening that fibrin clot up. So the fibrin threads are attached to the damaged vessel, remember? So they're going to start to contract as the platelets pull on them as the blood is flowing over it. So the clot begins to retract or pull the damaged edges of the blood vessel together, and this allows permanent repair of the blood vessels to begin as fibroblasts come in and start forming new tissue. So we want this clot to not be something permanent, right? So one, we start pulling it in and making it even smaller. But we do need to break that clot down, and that is an action we call fibrinolysis or thrombolysis, breaking down of that clot. So there is in the blood an inactive plasma enzyme called plasminogen. Remember, gen, beginning. And it's also a part of that clot formation. So the inactive plasminogen gets trapped in the clot. The damaged vessels cause the release of substances that are going to activate that plasminogen to active plasmin. Once plasmin is formed, it can dissolve the clot away by digesting those fibrin threads and inactivating some of the substances involved with clotting, such as fibrinogen and prothrombin and some of the clotting factors. So certain thrombolytic agents are chemicals that can be injected into the body to dissolve clots. So this is useful in with stroke victims. So they may either be directly injected, or they may either directly or indirectly activate that plasminogen. So the first drug that was used for this was called streptokinase, and that was back in 1982. So it's injected and it starts dissolving clots because it activates plasminogen to active plasmin. Plasmin is the clot buster. So this streptokinase was derived from streptococcal bacteria. Who knew, right? But now we've got a genetically engineered version of human TPA, tissue plasminogen activator. If that can be given to victims of heart attacks or strokes that are caused by blood clots, then that tissue plasminogen activator changes inactive plasminogen to plasmin, and it starts to break down that clot. There are certain things that can also cause clots to be more likely to form, okay? So normal clotting depends on having high levels of vitamin K in the body, because vitamin K is required to synthesize a lot of the clotting factors. So vitamin K, obviously, you make plenty of clotting factors, you're more likely to have proper blood clotting. Putting gauze on an injury can decrease the area or the diameter of those blood vessels, and also give the platelets something additional to stick to, so it increases that platelet aggregation, and also causes some of those damaged fragments to release even more tissue factor. And remember, tissue factor is very important in the early parts of that extrinsic pathway of activating those clotting factors. But we don't always want clots to form, so there are certain things that are anticoagulants or against coagulation, so things that inhibit clotting from occurring. And one of the most important things is simply undamaged blood vessels have a very smooth, slick endothelial layer, so the platelets have nothing to attach to and to aggregate. There's also a very simple anticoagulant, vitamin E. Vitamin E prevents platelet aggregation, but it also is a vitamin K agonist, or antagonist, So an antagonist works in the opposite direction. So it interferes with the action of vitamin K, therefore it interferes with proper clotting factor formation. As humans, we move around a lot, and because of that, there's a lot of wear and tear on body tissues, including blood vessels. So in our daily activities, we're having tiny little micro fractures of blood vessels, so tiny little damaged blood vessels, whether it's from a burn or a blow or fat accumulating within our blood vessels, or just normal movement and wear and tear of blood vessels. Sometimes small little clots occur. Now, if there's blood vessel damage, we want a clot to occur so that we don't end up with bleeding inside the body, right? But clotting can occur in an unbroken blood vessel, and it's usually within a vein, and that's called thrombosis. The clot itself is called a thrombus. Usually it dissolves spontaneously, but if it does remain, it can become dislodged, and then it gets into the blood and it's into circulation. So once that happens, the blood clot, or even a bubble of air or fat broken away, or a piece of debris that's transported in the blood, is now called an embolus. So if it stays in the blood vessel, it's a thrombus and stays in place, right? Once it breaks away, it's one type of embolism. So an embolus that breaks away from an arterial wall can lodge into small blood vessels and block the blood flow to organs. If this is a vital organ, obviously that's very important, and it can lead to death, such as when an embolus lodges in the lungs, and that is a condition known as a pulmonary embolism. So there are certain things that you can take that will help to limit the formation of clots. One of those is aspirin. So aspirin decreases vasoconstriction, so it keeps the blood vessels big. Should make sense that blood flows more freely through larger blood vessels, but aspirin also works to prevent platelet aggregation. Warfarin is an antagonist to vitamin K, so it decreases clotting factors. Decrease clotting factors, decrease clots. And then there's heparin. Heparin blocks the conversion from prothrombin to thrombin. Obviously, if you don't have thrombin, remember, you can't convert fibrinogen to active fibrin. So, limiting clots. A disorder associated with platelets is thrombocytopenia. Remember, platelets are also known as thrombocytes. So, thrombocyte, platelet, and then penia, remember, means shortage. So, shortage or deficient number of platelets. This can result in spontaneous bleeding, especially in small vessels that are shown or indicated by purple blotches that may show up on the skin. Of course, it should make sense to you that this can happen when there is something suppressing the bone marrow, such as cancer of the bone marrow destroying the tissue, cancer of the bone destroying the marrow and the tissues, or anything such as the chemotherapy and the radiation that suppresses the action or destroys that tissue as well. And certain drugs can also suppress the action of that bone marrow and those stem cells. The other thing I want to look at is hemophilia. Okay, hemo, blood, philia, loving. These are sometimes people that are called free bleeders. So this is an inherited deficiency of clotting where bleeding can occur spontaneously, or even if you just have a very mild trauma. It's also the oldest known hereditary bleeding disorder because there are descriptions of this dating back to the 2nd century AD. Hemophilia is more common in males and also sometimes referred to as the royal disease because a lot of the descendants of Queen Victoria have been affected by this. There are different types of hemophilia, and that's due to which clotting factor is affected, which clotting factor doesn't work. So these different types also can exhibit very different degrees of severity, from being really mild to where it doesn't cause a problem to very severe bleeding, both internally and with minor injuries and paper cuts. So hemophilia is characterized by spontaneous or traumatic subcutaneous and intramuscular hemorrhage, or nosebleeds, blood in the urine, hemorrhage in joints that produce pain and tissue damage, of course. So treatment of hemophilia is usually transfusion of flesh blood plasma, or even concentrates of the clotting factor that the person is deficient of, so that they do have that inactive clotting factor in the blood since they can't make it. And these just help to simply reduce the tendency to bleed.